A Guide to Discharge Teaching Using Mesro's Transformative Learning by Ara, Yesenia, Nicole, Rika, Kyle, Jasmine, and Christine. The following were our group roles.
In this presentation, we will explore these learning techniques through a nursing scenario. Our objectives are to demonstrate a teaching skill which utilizes the Kolb learning modes and illustrate ways teaching can be completed through Mesro. Together, we have prepared a presentation which helps clarify methods of patient teaching and education, targeted towards acute care RNs.
Our population is engaged in the phase recognizing discontent.
You have just discharged a patient. You return to work 4 days later and find the same patient was admitted for CHF exacerbation. Because you failed to provide the appropriate discharge instructions, the patient is currently unstable. What do you do to prevent this from occurring again with other patients?
A patient is being discharged from an acute care facility with a diagnosis of CHF. They know nothing of the disease or how to manage their illness. CHF affects nearly 5 million Americans, and approximately 550,000 new cases are diagnosed every year.
Act 1 scenario. The RN is inside the patient's room and the patient is about to be discharged and she is conducting CHF discharge teaching at this time.
Hi, Mrs. Smith. It looks like the doctor put in discharge orders for you to go home, so I am going to go over the patient education with you in regards to your diagnosis of CHF.
Oh, okay, so fast. No one tell me I go home today. It's okay if I go home? The doctor said it was okay?
Yes, the doctor cleared for you to discharge you, and you're going to go home today as soon as you have a ride home.
Oh, wow, that's so fast. I call family. Okay, I speak very little English, so go slow, please.
Don't worry, I'll go over with you slowly.
Okay.
So first in this packet is your follow-up care instructions with your doctors. Please call them to make appointments with them after discharge. On the next page is the medications that the doctor has prescribed. There are 2 medications that have been electronically sent to your pharmacy, so please make sure you pick them up and take them as prescribed. They are metoprolol and furosemide. Included in the packet is more information about the 2 medications in case you want to read about them more in detail. The following 10 medications are the ones that you have already been taking at home. The following pages are material for you to read about your diagnosis of congestive heart failure in case you want to read more about it. Do you have any questions for me?
What's this new medicine?
Oh, those medications are for your heart condition. Don't worry, they are the same medications the doctor started prescribing you upon admission. He just wants you to continue taking them.
Oh, I'm so confused. Why am I taking these medications?
The doctor prescribed them to you and you're supposed to take them.
How do I take my new medications with my old ones?
Pharmacy will explain everything to you.
Oh, I feel like I'm taking too much medicine at one time. Is this okay?
All the reasons why you are taking the medications are in the packet you are receiving.
Okay, what about if I feel like I'm having a hard time breathing or dizzy in the morning?
All the symptoms you need to be concerned about are listed in your discharge packet. Do you have any more questions for me before you go home?
When do I see my doctor again?
You need to call and schedule a follow-up appointment.
Okay, I guess that's it. I'm still kind of confused, but I have to go. Bye.
Okay, bye.
The following scene showed poor discharge teaching from the nurse to the patient. She failed to recognize a language barrier from the patient and did not perform a teach back method. She did not anticipate the patient's needs or questions. She did not address the medication, the patient's condition, side effects from the medication, or potential CHF complications. Did not ensure a follow up appointment or reassure the patient's worries or doubts. Start of Act 2. Nurse leader recognizes and addresses the dilemma. Calls for discharge teaching class for all nurses on the unit. Scene 1. Nurse leader is talking to the nursing staff about the inappropriate discharge and education she had with her one-on-one CHF patient. You have just discharged a patient. You return to work 4 days later and find the same patient was admitted for CHF exacerbation. Because you failed to provide the appropriate discharge instructions, the patient is currently unstable. What do you do to prevent this from occurring again with other patients? I want you all to think about this for a couple of minutes and then tell me how this statement makes you feel.
I feel disappointed in myself for not doing my job and effectively teaching my patient about management of their chronic disease.
Thank you, Ashley. What advice are you giving yourself? What do you interpret is happening within that statement?
I'm telling myself to assess the situation and determine whether I would have to specialize approaches towards teaching my patient. I should be able to teach in terms that the patient understands and provide opportunities for patient teach back. The statement sounds like a nurse was too busy to properly educate the patient and relied on printed handouts to do the job.
Okay, great. You understand that's unacceptable for a patient to be readmitted for the same problem you're in charge of preventing by providing the appropriate education. As you dive deeper into how this makes you feel, tell me, how would you prefer the situation to be different?
I'm sure my colleagues would agree with me when I say the best scenario would be that the patient completely understands self management of CHF and understands signs and symptoms of possible attack.
Exactly. Appropriately educating patients prior to discharge is our responsibility. Merely giving them a printout of documents will not verify that the patient understands what is expected of them when they return home. Can everyone agree that the patient's well being and safety are our top priorities? Perfect.
Act 2, Scene 2. Two nurse leaders, Rika and Kyle, are teaching the entire cardiac RN staff about appropriate discharge in an in service educational meeting. Hello, we are here to teach you all how to appropriately and effectively discharge patients with CHF. Readmission is common among these patients because of exacerbation, and one of the most important ways to prevent that is to make sure we are giving optimal discharge education. It's also important to know when your patient does not understand the education you are giving them. Our job today is to provide you with various ways for effective discharge teaching. So, how many of you have already experienced providing discharge information to a CHF patient? Wow, there's quite a few of you who have not experienced it, and that is okay. This is a new experience, and as we all know, CHF is complicated because of the many things that can go wrong. This is why discharge education is vital. I want you all to first close your eyes and put yourselves into your patient's shoes. Imagine you are the CHF patient and your nurse providing education to you that you simply just do not understand. She's speaking really fast and even appears to be nervous. Now imagine you only understand English and your nurse is talking another language. She looks frantically for help and decides to have your friend who is with you translate. As your friend is translating, she looks just as lost as you, saying these weird medical terminologies. All of a sudden, your nurse gives you 3 pamphlets on CHF and sends you on your way home. You do not really understand what is going on, but agree to leave anyways. You just want to go home. How do you feel? Now open your eyes. Every time you are providing discharge education, always remember how you just felt so that you make sure your patient does not feel that way. What can you all learn from what you have experienced as you were closing your eyes? 1. Do not rely on a family or friend as a translator. Seek colleagues with medical backgrounds to avoid biases. 2. Your nurse needed to slow down and take her time. Your nurse should have seen from the beginning how confused you were. She needed to acknowledge your first sign of confusion and try to fix it. She needed to also provide the education in those brochures in a simpler way to her patient directly instead of just simply handing it to her. Next, we are going to see how much information you have all retained from prior CHF discharge lessons. Some of you might have heard of the teach-back method. This is a way for patients to be interactive with what they have just learned at discharge. After you have educated them, you can then ask them to repeat back in their own words what they learned. That's the important part, in their own words. Patients should be able to state the reason for their cardiac medications and list basic signs and symptoms to look for if they're experiencing exacerbation. If family members are around, they should be able to recite back what you have educated them on as well. Think of this method as another assessment and evaluation of your patient's knowledge. This will be the best time to correct them if needed or clarify anything you find out they may not understand. There really is no better way than the teach back method to really see for yourself if your patient is educated on their health plan. Now, we are going to practice the teach back method of what we learned today to each other. Now go ahead and split into partners. One person is the patient and the other person is the nurse doing the discharge teaching. Nurse Kyle and I will be walking around to each pair to assess your teach back method and answer any questions you might have.
Now that all of you have witnessed a concrete and active form of congestive heart failure teaching, what do you think the positives and/or areas for improvement are in regards to the education? Do you think anxiety or depression could have affected the patient's reception of the information? Do they have health literacy? In many situations, patients may be given all the needed information, tools, and practice, but may lack the drive or ability to appropriately use the information. Knowing your patients and discovering what drives them will enable you to customize the teaching to that individual. Understanding if they have social support can also be a driver of success or failure in the education. Repetition is key, and as healthcare providers, we must be willing to constantly and consistently provide education to those who have difficulty absorbing the information. For example, in nursing school, I remember constantly reviewing arterial blood gases, never able to retain the information. This is the same for your patients, who you may believe to be non-compliant. Be patient and empathetic when instructing, because the minute we judge or chastise, we lose that patient's trust. Now it is time to apply your ideas. Take what you have learned here and apply it to your own practice. The education of our patients must be patient-centered and changed based on the individual patient. We want to instill control over their illness and give our patients autonomy over their care. Patients who are compliant with their medications, diet, and management of CHF symptoms have a reduced rate of readmission and mortality. Patients are in the hospital because they need support managing their disease, and it is up to us to support them through this journey.
Act 3. After the in-service educational meeting, the RN is now acting on a new perspective after self-reflection and applying new teaching strategies. Mrs. Smith, who was discharged recently, was readmitted for CHF exacerbation again. The RN is discharging Mrs. Smith once again. I see a discharge order on my patient's chart. I need to see where the interpretalk is and update my patient. Hi, Mrs. Smith. How are you doing?
I'm feeling okay. Do you know what is happening?
You can be discharged home today, which means the doctor gave you the okay for you to go home.
Oh, that is good news. What time and what should I do?
Right now it is 3 p.m. You can be able to go home approximately in the next 1 to 2 hours. I will gather all your discharge information and provide some education for you, and make sure you have everything you need before you go. I want to make sure you're comfortable with the education you receive here before going home. Who will be picking you up?
My son can pick me up. I can call him to pick me up in an hour or so. Can he learn what is happening too?
Of course, I will be teaching both of you. Do you prefer discussion, visual aids, audio aids, and or learning by doing?
I like group discussions and reading information in Russia.
Okay, I am going to confirm all your discharge information and gather your information for home. I will be right back with your discharge packet and teaching you and your son when he comes to pick you up. I'll take out your IV and return the heart monitor to our hospital, but right before you go.
Okay, I will call my son right now. Thank you, dear.
1 hour later, the son is at bedside and the patient is ready to go home. The nurse took the interpretalk to speak to the patient in Russian. Okay, are you all set to go home? I'll go over the information and paperwork with you and your son.
Yes, I am. Thank you. I want to learn how to avoid having this happen again. I still don't know why this even happened to me.
Of course, I want you to feel comfortable after this discussion before going home. Do you know about your condition?
Honestly, not really. Something with my heart. It makes me swell up and makes it hard to breathe.
Yes, it's called congestive heart failure, or CHF for short. Your heart's job is to pump blood, which contains oxygen, to the rest of the body. However, with with CHF, the heart does not pump very well and the blood does not move through the body as it should. As a result, fluid backs up in either the body or the lungs.
So my heart is causing me not to breathe and to swell?
Yes, your heart is not working as well as it should. Symptoms you had from it was your swollen feet, feeling tired, and trouble breathing, especially if you lay flat on your back when you sleep.
Okay, so I should sleep with multiple pillows so I can breathe better. How should I prevent my problems with the swelling and breathing problems?
So as you can see here with your prescription list right here, feel free to ask me questions as we go. So the doctor has prescribed you medications to your preferred pharmacy. This one's the important one, Lasix. So this is a medication that makes you urinate more. It decreases the fluid buildup in your body and your lungs, which makes you feel more comfortable.
Okay, that's a water pill that made me lose all that weight and breathe better.
Yes, Lasix is important to prevent all the fluid buildup. It is also important to weigh yourself every day, same scale and same time. This is so you can see the Lasix medication is working as it should. Do you have a scale at home?
Yes, I do. I have a scale at home.
Great. If you see that you gain more than 3 pounds in one day or 5 pounds in 1 week, you'll need to call your doctor. When you're at home, when you check your weight, what are you checking for?
I'll check every morning after I pee. I'm checking to see if I'm not gaining too much weight. 3 pounds in one day, and I forgot the other one, but I think you said five something.
Yes, you're correct. You will report to your doctor if you gain 3 or more pounds in one day or 5 or more pounds in 1 week. It's important to track your weight and to see if your medication is working.
Wow, does this mean the medication will make me lose weight and I don't need to exercise ever again?
It's important to stay active, which means it keeps your heart healthy. The American Heart Association recommends to start slow and gradually build up your tolerance to 30 minutes of activity, about 5 or more times a week. What kind of exercises do you like?
To be honest, I love to walk my dog. Does that count?
Yes, start slow and build up your tolerance. It's important to have 30 minutes of moderately vigorous activity, which is like brisk walking, swimming, and biking. So, walking your dog is very good.
Okay, so let me see if I get this right. Take my medication, weigh myself, and walk every day with my dog.
Yes, you'll need to make sure that your blood pressure is also controlled. So, the doctor also prescribed you atenolol and lisinopril to control your high blood pressure.
Okay, yes, I already took those medications before. What was my blood pressure here again?
Your blood pressure was usually around 140 over 80. Blood pressure above 120 over 70 is considered high, also known as hypertension. I recommend having a blood pressure cuff to measure at home.
I do have a blood pressure cuff at home, but I honestly didn't check that often. Should I?
That's great that you have a blood pressure cuff, so go ahead and use it before you take your blood pressure medications. If you ever experience any side effects such as dizziness or feeling faint, be safe and have a seat and recheck your blood pressure. Don't try to get up too fast and fall. If you have consistent side effects or experience coughing, shortness of breath, or swelling, please contact your doctor. Do you understand?
Yes, I took these medications before. I haven't been taking them as I should, to be honest. I'll be much better about it and take my blood pressure every day. I didn't realize I really needed to. Thank you.
Yes, no problem. It is very important to be consistent with taking your medications as prescribed. This will help you to stay healthy and out of the hospital. If you ever see any early side effects or worsening symptoms, report to your doctor as early as you feel them, just to prevent your condition from getting worse. What will you do with your blood pressure medications?
Okay, let me see if I remember. I will check my blood pressure every day, take lisinopril and metoprolol every day as prescribed, and continue to see my doctors. Is that right?
That sounds like a great plan. I also want to encourage you to eat a low salt diet, no more than 2 grams. This is to prevent high blood pressure and salt worsens the swelling. If you eat too many salty foods, it makes your medications, like Lasix, not work as well. What do you usually like to eat?
Oh, to be honest, I like to eat microwavables like my cup of noodle soup and frozen TV dinners. Those are my favorite.
Oh, I see. So microwavables are actually, they have a lot of salt content. If you read the food label, it's important to look out for the sodium content. Frozen foods have a lot of salt just to preserve them, but not all microwavables are bad, so you don't have to completely cut them out. But you should be aware and buy the ones that have low salt content, about 200 to 300 milligrams of sodium. Um, 1000 milligrams is a gram. Try not to eat more than 2000 milligrams or 2 grams of salt every day. I'll write down these numbers for you here on your pamphlet.
Okay, thank you. I might not remember those numbers. I never learned about food labels and I just eat whatever I like. I don't want to think about how I eat. That sounds hard.
I understand it's hard. Change does not happen overnight. Just take baby steps towards the right direction, and that's what's important. We also have resources. I can refer you to a dietitian, and they could tailor a meal plan that is more realistic to your day to day life.
Yes, that would sound good. I hope the dietitian is Russian like me so it makes more sense. I don't want to eat food I don't like, but I also want to eat less salt. I won't add salt to my food anymore now that I know this.
That's great. And of course, I could refer you to a dietitian that can speak Russian. Otherwise, they could have an interpreter as well. I'm glad that you feel self empowered to make that change. Let's go over what we previously discussed before we move on. What are 3 things you will do differently when you go home?
Okay, let's see. I will definitely take my medication as prescribed, wake up in the morning, weigh myself every day, and try to eat less salt, like maybe the cup of noodles that I was eating a lot.
Yes, those are great. Remember, if you experience anything out of the ordinary, side effects, weighing more than 3 pounds a day or 5 pounds a week, swelling and or shortness of breath, call your doctor.
Okay, thank you, Nurse Jasmine, for writing all the numbers out for me. I like all this information you printed out in Russia for me. Thank you.
No problem, of course. Your follow up appointment is with Dr. Patel at his Heart Healthy Clinic on 123 Pleasanton Way at 1 p.m. in 3 days next Monday. I wrote it all down right here, all highlighted. Your prescriptions are ready to be picked up at your preferred pharmacy, Walgreens on Village Way, correct?
Wow, yes, this is correct. Thank you for highlighting. Now I can see before there was too much writing. I will have my son pick them up for me and go to my appointment with Dr. Patel next Monday.
Perfect. From what you learned today, what will you do differently this time around?
To be honest, all this information made me want to think about things differently. I didn't do anything before. I never knew what I should have done. I didn't know the language they were speaking last time and I was too scared to tell them. They seemed busy and I didn't want to bother them. Thank you for getting the translator and pamphlets in Russia. I will check my blood pressure and weight myself every day, walk my best friend, my dog, take my medications every day, and try to eat less salt. Things will be different from now on.
That sounds great. It's good to get a Russian translator for you so you don't feel afraid to ask, or don't feel afraid to ask for one, even if they seem busy. Your health and education is important to us. Do you have any questions for me?
Actually, no, you've answered everything for me. Thank you so, so much. I'm ready to go home.
Okay, I will place all your discharge information in this packet and have you sign some paperwork. Thank you. It's been a pleasure taking care of you. Couple weeks later. Oh wow, that patient from weeks ago nominated me for a Daisy Award. She wrote that she was appreciative of putting in the time to teach her and feel comfortable about her condition. No one prior ever taught her anything, and she felt scared she was going to die because she was in the hospital again. I helped her feel more empowered to take care of herself. I think I did the right thing in getting the translator, assessing her learning preferences, understanding, teach back, and chunking my teaching as I go. I will definitely make sure my discharge teaching is like this from here on out.
Conclusion. Many factors affect the learning environment as demonstrated by this dilemma. In this presentation, our goal was to illustrate teaching skills nurses can use in real-life settings when faced with difficult learning environments. We use a foundation set by Kolb learning techniques, as well as Mesra's transformative learning styles to show methods nurses can use to navigate patient teaching in the real world.
Thank you for listening. We hope you enjoyed this presentation. These are our references.